Video provided by iBuyDiabeticSupply.com. This video will go over the common and important questions that a patient might have about Brilinta. 1. What is Brilinta used for? Brilinta, Ticagrelor, is a medication primarily used to prevent blood clots in individuals with acute coronary syndrome, ACS. ACS includes conditions such as unstable angina, chest pain, or heart attack. It is prescribed along with aspirin to reduce the risk of further heart-related problems. 2. How does Brilinta work? Brilinta belongs to a class of medications called platelet aggregation inhibitors or antiplatelet drugs. It works by preventing platelets, blood cells responsible for clotting, from sticking together and forming harmful blood clots in the arteries. By inhibiting platelet aggregation, Brilinta helps maintain blood flow through the blood vessels, reducing the risk of heart-related complications. 3. How should I take Brilinta? Brilinta is typically taken orally, with or without food. The usual recommended dose is 90 mg mg, twice daily for the first year. After the first year, the maintenance dose is usually reduced to 60 mg twice daily. It's important to follow your doctor's instructions and take Brilinta exactly as prescribed. Do not change the dosage or stop taking the medication without consulting your healthcare provider. 4. What are the common side effects of Brilinta? Common side effects of Brilinta may include bleeding, such as nosebleeds or bruising, shortness of breath, headache, dizziness, nausea, diarrhea, and a feeling of weakness. These side effects are generally mild and temporary. If you experience any concerning or persistent side effects, it's important to notify your healthcare provider. 5. Are there any serious or rare side effects associated with Brilinta? While rare, there are serious side effects associated with Brilinta that require immediate medical attention. These include severe bleeding, e.g., prolonged bleeding from cuts or gums, signs of an allergic reaction, e.g., rash, itching, swelling, severe dizziness, and symptoms of a serious condition called angioedema, e.g., swelling of the face, lips, tongue, or throat. If you experience any of these severe or rare side effects, seek medical help right away. 6. Can I take other medications or supplements while on Brilinta? It's essential to inform your healthcare provider about all the medications, supplements, and herbal products you are taking before starting Brilinta. Certain medications, such as other blood thinners, some antibiotics, antifungal drugs, and certain antidepressants, can interact with Brilinta and increase the risk of bleeding or other complications. Your doctor will consider potential drug interactions and adjust your treatment accordingly. 7. Are there any food or drink restrictions while taking Brilinta? There are no specific food restrictions while taking Brilinta. However, it's generally advisable to follow a balanced diet and avoid excessive alcohol consumption, as alcohol can increase the risk of bleeding. 8. How long do I need to take Brilinta? The duration of Brilinta treatment varies depending on individual circumstances and the presence of underlying heart conditions. In most cases, Brilinta is prescribed for at least 12 months following an ACS event, along with low-dose aspirin. After the initial period, your doctor will assess your condition and determine whether to continue Brilinta therapy. 9. What should I do if I miss a dose of Brilinta? If you miss a dose of Brilinta, take it as soon as you remember, and then continue with your regular dosing schedule. Do not take a double dose to make up for a missed one. If you are unsure about what to do, consult your healthcare provider. 10. Can I stop taking Brilinta abruptly, or should I gradually decrease the dosage? It is important not to stop taking Brilinta abruptly without consulting your healthcare provider. Suddenly discontinuing Brilinta may increase the risk of blood clots and other cardiovascular complications. If you have concerns about stopping Brilinta, your doctor will provide guidance on the appropriate way to taper off the medication or recommend an alternative treatment plan. 11. Are there any interactions between Brilinta and other medical conditions I have? Brilinta may interact with certain medical conditions. It is crucial to inform your doctor about any pre-existing conditions you have, especially bleeding disorders, liver disease, kidney disease, or a history of stroke. Additionally, let your healthcare provider know if you are scheduled for any surgeries or dental procedures, as Brilinta may need to be temporarily stopped to reduce the risk of excessive bleeding. 12. How long does it take for Brilinta to start working? Brilinta starts working quickly after the first dose, typically within 30 minutes. Its effects persist for about 5 days, as the medication gradually leaves the body. It's important to continue taking Brilinta as prescribed by your doctor to maintain its benefits. 13. Will I still need to take aspirin while on Brilinta? In most cases, Brilinta is prescribed together with low-dose aspirin, usually 75 to 100 milligrams daily, to further reduce the risk of blood clots. Aspirin and Brilinta work in different ways to prevent clot formation. However, the exact regimen may vary based on individual factors. Always follow your doctor's instructions regarding the use of aspirin and Brilinta. 14. Can I drink alcohol while taking Brilinta? Moderate alcohol consumption is generally considered acceptable while taking Brilinta. However, excessive alcohol intake can increase the risk of bleeding. It's advisable to consult your healthcare provider regarding alcohol consumption and any potential interactions with your specific health condition. 15. Is it safe to use Brilinta during pregnancy or while breastfeeding? Brilinta should be used during pregnancy only if clearly needed and under the guidance of your healthcare provider. It is not recommended to breastfeed while taking Brilinta, as it is not known whether the medication passes into breast milk. 16. What should I do if I experience any unusual symptoms while taking Brilinta? If you experience any unusual or concerning symptoms while taking Brilinta, such as severe bleeding, allergic reactions, chest pain, or difficulty breathing, seek immediate medical attention. It's important to promptly report any changes in your health to your healthcare provider. 17. Can Brilinta cause bleeding or increase the risk of bleeding? Yes, Brilinta can increase the risk of bleeding. It is an antiplatelet medication designed to prevent blood clotting, but it can also affect the normal clotting process. While most bleeding episodes associated with Brilinta are mild, it's important to be cautious and report any unusual bleeding, such as prolonged or excessive bleeding, to your doctor. Thanks for watching. I buy diabeticsupply.com.